Welcome to another episode of Perspectives, hosted by Ikansh and Asha Tambe. COVID-19 has shut down our nation. By taking precious human lives without bias, it reminds us that we're all connected and created equal. Last week, we heard from critical care pulmonologist Dr. Raksha Jain about what treating the virus looks like from the perspective of a healthcare professional. Today, we'll hear the perspective of a recovered COVID-19 patient. We have with us Mr. Darrin Godin, who won the fight against the virus a few weeks ago. Thank you so much for joining us, Mr. Godin. We're really excited to hear from you and learn from your experiences.
Thank you both for having me.
So we'll jump right into the questions. We know you've been through a lot over the last few weeks, so how are you feeling now?
Feeling much better, actually. It's been about 6 weeks since I got out of the hospital, and so recovery was slow, but I'm feeling much better, and actually going back to work on Monday. So thanks for asking.
That's great. I can't imagine how rough your journey must have been. So it's really good to hear that you're feeling better.
Thank you.
So let's take a second and take it back to the beginning. Do you know how you first came in contact with the virus?
I don't know for sure. As far as I know, I wasn't around anybody who had tested positive, or at least that they knew they tested positive. So I really think it was through community transmission, and it was probably being around somebody who was either asymptomatic or was having some sort of symptoms but didn't realize it was the virus. And for whatever reason, I was infected. So
Yeah, I'm sure given the contagious nature of the virus, I would imagine it's very difficult to know where you got it from.
We know that most patients complain of coughing and shortness of breath when they contract the virus. Is that what you experienced as well at first, or is that something that developed later on?
yeah, it's something that developed over the next couple of days. So my symptoms started with a headache, and then went to a little bit of a dizzy spell the next morning. And then by the next morning, I actually had a really high fever around 103 that wouldn't break over the entire weekend. And then later that weekend, the cough started to develop. Then I also noticed that as I was laying down trying to breathe, like a rattle in my chest. And so based on all of those symptoms, that's when I did a virtual visit and decided to go looking for a testing facility. And doing a virtual visit with a doctor, they actually told me I should go to the emergency room. So that's when I went on that following Tuesday.
So that was about 3 days after you first started showing symptoms of coughing
Yeah,
and like the
three or four
flu-like
days.
symptoms.
Yeah, 3 or 4 days.
So how did you manage to isolate yourself from your family members in your own house once you were infected?
Yeah, I didn't think I had coronavirus, so we didn't really do any sort of isolation leading up to it. In fact, the day that I was admitted to the hospital, I did not think I would be admitted to the hospital. So I drove myself and was not expecting that at all. So we did not really isolate, but my wife ended up being positive as well. So once I was in the hospital and tested, the health department reached out to her and got her tested. They didn't test our children, but my wife was positive. So the entire time I was in the hospital, and then for weeks after, she pretty much stayed in the house, and nobody left the house for more than a month.
What was it like to be separated from your family owing to a life-threatening disease? I mean, like, what were you and
Yeah,
your family feeling?
yeah, good. Thank you for asking that. It was very scary. Like I said, I didn't really think I had it, and I didn't expect to go into the hospital. So when the virtual visit doctor told me to go, I went, and I thought maybe I would be dehydrated, and they would give me some intravenous fluids and then send me home. But when they took a chest X-ray and they were able to see, I imagine the pulmonologist you met with last week talked about the chest X-rays and how they're able to tell by some of the pattern that's within the chest X-ray that there's a potential for coronavirus. Once they read my chest X-ray, the doctor was pretty certain I had it, but he needed to confirm that with a nasal swab. So as soon as those words came out of his mouth, I was very fearful. You've only been hearing about it on the news at this point. It was only March 17th for me. So we'd heard a lot about it, but it was like out there and not right here. And when someone tells you you have it, it was pretty scary, and yeah, very, very fearful. And then to be separated, my wife couldn't come to the hospital. There was no visitors allowed. And that whole week
Oh
I
God.
continued to get worse. And by that following Saturday, they were putting me on a ventilator. And my wife still had not been able to see me. So she didn't see me until I got out of the hospital. And just really grateful that I actually recovered and came off the ventilator, because as you
That's,
know, so many people are not coming off the ventilator.
yeah, that's terrible. Were you able to FaceTime your wife while you were in the hospital or talk to her on the
Yeah,
phone?
we did both a little bit, but leading up to going on the ventilator, I just continued to get sicker and sicker, and it was very difficult to breathe. They were trying different masks on me to increase the flow of oxygen that I was able to get and the pressure to get it into my lungs. So I would say by a few days after being admitted, um, we didn't talk a whole lot because I couldn't talk very much.
Hmm.
So the conversations would be very short. And then, of course, once I was ventilated, you're also sedated and pretty much in a induced coma. So yeah, we didn't talk until I came out of that.
I know you have some young kids. How did they handle this situation?
I have a 2-year-old and 6-year-old, both boys, and my wife actually thought that they were kind of unaware of the whole thing the whole time. My wife was, especially during the 9 days on the ventilator, she was very scared and crying quite a bit, and responding to people's text messages and waiting for the calls from the doctors or the nurses for the updates. So she thought they were both kind of unaware. It wasn't until I got home from the hospital and I was talking to my 6-year-old, and he told me he thought I was going to die. And so my wife was like, suddenly realized like he did actually know what was going on. We had gone to a memorial service for a family friend weeks earlier, and that was the first time my 6-year-old has been to something like that. And they had given out the gentleman was a collector of different things, and he collected patches that you can sew on your backpack or your clothes or whatever. So they actually were giving out all these patches as kind of something to remember him by. And so my 6-year-old told me he was afraid I was going to die. And then he said, I just kept thinking, what does my dad collect? What are we going to give to people at his funeral? Which is a hard thing to hear your 6-year-old say, because
Hmm.
nobody wants their 6-year-olds to be worrying about their dad dying. So
Yeah,
That
that's
sounds.
terrible.
yeah,
It's terrible. Yeah, no kid should have to go through that. No
yeah.
kid should have to think that.
So a big part of your story is that you were in a coma for 9 days. Can you recollect what was going through your mind when you woke up?
Yeah, it took about probably a good 24 hours um, before I was clear-headed enough, because of all the sedation medication, the
Hmm.
paralytic medication, to really even understand like where I was. So by the time I was coming to enough to start realizing I'm in the hospital, um, I didn't have any memory of going into the hospital. Like I actually didn't remember anything from the time they told me that I probably had coronavirus to coming off the ventilator. So um, my body was really weak. I remember my wife trying to call. My phone went missing for a couple of days. Like while I was on the ventilator, they had moved me rooms, and I thought my phone had been placed with my other personal belongings in a closet, but I had a nurse check. She couldn't find them there. Somehow they ended up somewhere else. So I didn't get my phone for a couple of days. So my wife called on the hospital phone, and I reached for the phone because they had left it close to me. And I was so weak that when I tried to pick up the phone, I actually dropped it on my head,
Oh God.
because I didn't realize like how your body was impacted from being on the ventilator for so long. So I can't imagine people who are on ventilators even longer. It's taken a long time to get that body strength back. I couldn't walk, all that stuff. But in terms of what was going through my mind, I was just frustrated because I didn't understand what had happened to me.
Mhm.
At that point, I wasn't even really remembering that like I had the virus, and I didn't know I had been on a ventilator. I couldn't talk very well because the tube that had been down my throat. So it was finally that day, one of my nurses, she asked me why I wasn't eating. Was I feeling not hungry, or did I have nausea or something? And I just said, I'm frustrated. I said, I can't even get my hand to pick up the fork and bring it to my mouth. Like, imagine like trying to pick it up, and then like the action of bringing it to your mouth, it felt like it was like a mile away and felt like it was never going to get there. And so I was so frustrated that I told her, I don't even know what's going on. And so at that point, she explained to me what had happened, and that I had been on a ventilator and how that affects your body and your motor skills and your strength. And so I think it was at that point that I started to kind of understand. But at that point, I wasn't scared anymore, which was weird because I felt better. I wasn't coughing anymore, and I could breathe. They just had me on a nasal cannula of the lowest oxygen setting, and so breathing was not a problem anymore. So that was good. But just the body weakness and everything else was the most
Mhm.
frustrating part.
Wow, that sounds really scary.
Yeah,
Yeah, it
it
is
was
really
scary for
scary.
sure.
Not even being able to comprehend like why you're there, having a nurse have to explain to you
Yeah,
what was going on, what you just been through. Yeah, that's terrifying.
yeah.
Is the feeling when you're laying there helpless on a hospital bed, barely being able to breathe, you mentioned so weak, is that comparable to anything you've ever felt before you thought you'd ever feel in your life?
No, it was no, it's not. It was a very defining thing for me. It was not something I've ever experienced before. I'd never been in the hospital before. Never had any major illnesses or surgeries or anything. So no underlying health condition. So yeah, it was scary. And it just certainly made me, once I was beyond the ventilator and regaining a little bit of strength and getting ready for discharge, and since even being out of the hospital, so appreciative of life in general and all the small things in life, and has
Exactly.
really just caused me to look at things totally differently. So the things that a lot of people stress out over, those feel like small things to me now. And again, just a overwhelming sense of gratefulness to those who cared for me, people who were praying for me. And I also had this sense of indebtedness to those who took care of me and got me home, and the sense to kind of pay it forward and help other people.
You mentioned how your family supported you and how your wife supported you, but what were some other acts of kindness that you received from non-family members? You mentioned the
Yeah,
indebtedness to the hospital staff.
yeah. So obviously the hospital staff was doing just an incredible job. I was the first patient at the hospital I went to, actually, who was positive and COVID positive, and they provided me great care, obviously. But beyond that, I had a friend who created a Facebook group, so that a lot of people wouldn't be trying to get information from my wife or getting updates, since it was such a difficult time for her while I was on the ventilator. He created a Facebook group and really just asked people to pray. And that kind of spread around the world. And we've since heard, I mean, it's literally thousands of people from all over the globe that were thinking about me and praying for me. They also did kind of what I think it's called like a meal train or something. So people started sending either DoorDash or, other food delivery, or making food and bringing it over. And so yeah, probably the first 3 weeks that I came home from the hospital, my wife did not have to cook hardly at all, because people were bringing meals almost every other night.
Mhm.
And that was super appreciative. People sending gifts and things for my kids, and tons of cards came in the mail as well. So I had lots of those to read when I came home. My employer was really great. They were checking in with my wife all the time, and they were making sure she had what she needed. They've been really great to give me time off and let me heal and let me recover, and very supportive. So the neighbors, my in-laws, like everybody, it's just really amazing to see community come together and support a family in their time of need. So
That's amazing. Yeah, that's amazing. It's amazing how tragedies and crises like this bring out the best in all of us as human beings. I mean, all throughout the
yeah,
U.S., as we've seen,
yeah,
appreciation for medical professionals and support for an amazing support for people like you.
thank
So
you.
as you mentioned earlier, you were saying you were too weak to pick up a phone or eat. What was the full recovery path once you were out of critical care?
Yeah, so they kept me in the ICU for a couple days, or like maybe a day and a half after I came off the ventilator. Then they moved me to a step down unit. And in that step down unit is where you would normally start to get some physical therapy to help you regain strength. So I had 2 visits from the physical therapist. The first day that they tried, um, could not get off the edge of the bed. So you would think your mind tells you you're able, your body tells you otherwise. And so all they wanted me to do was put my upper body weight onto a walker and straighten out my legs. I was sitting with my legs off the side of the bed. And that seemed like it was impossible to do. So that's frustrating when you're
Mhm.
a grown adult with the abilities and you just feel like, why can't I do this?
Hmm.
Um, the second day that they came in was actually the day that they came to do an assessment, because I had talked to my doctor and I said I would really rather just go home and recover at home now. If it was a matter of just regaining strength now, there was no reason to keep me in terms of my blood tests or my X-rays. Everything had been looking much better. I really just felt like I would recover better if I had my family around me. So the doctors said, well, if physical therapy gives you the assessment and they agree that you're safe enough to go home in your house,
Mhm.
um, there's no reason to keep you, so we'll let you go. And so that day I willed myself into showing the best ability that I could, and was able to do everything they asked me to do very slowly, but they did agree that I could go home. So I went home. Um, Looking back on it now, it was only 3 days after coming off the ventilator, and my wife was even surprised that I convinced them to let me go home. And it was a little tough over the first few days because getting around was hard. I had to use a walker, needed help getting in and out of the shower, like all that stuff. So and I could barely just walk around the house with the walker, but that began to improve over the next few weeks. I would go out for little walks with the walker. Always took somebody with me in case I just was, too weak, couldn't get back or whatever. But now, even this morning, I took a walk probably about 1.5 miles. So things are getting better, which is good. So
That's great.
probably
Yeah.
could have gone longer too, but
That's
yeah,
great.
so it's been tough. So there are also some, COVID does not just impact your lungs. And we've been hearing a lot more about this recently, that
Mm-hmm.
now they're starting to see things where it's affected other organs and your brain and that sort of thing. So one of my follow-ups was with a neurologist. Some of the symptoms I was having outside of the hospital, in terms of weakness and balance issues, one of my doctors had called me after the hospital, and I explained to him what I was still feeling, and he didn't think those were something I should still be having issues with. So I did a follow-up with the neurologist. They did an MRI. Everything seemed to come back pretty good, but he did tell me that for a while I won't feel quite as mentally sharp, which was kind of scary to hear because I'm in an executive role at work and going back to work on Monday and kind of need to be sharp in that role. So he said it'll come back. He said it's just a matter of time. But for me, I didn't want to stay out of work longer. I wanted to get back, just like the physical part of it, and getting stronger and doing exercise and walking has seemed to, the more you do it, the better you get. I also feel like getting back to work, the more I start getting my brain more engaged, I think that will help that recover quicker as well. So yeah, it's been a long process. Like I said, about 5.5, almost 6 weeks out from the hospital. And I feel about 95% today, which is still pretty good. So and that's
Inspiring.
something that
Yeah.
people aren't talking about. If you watch the news, no one's really talking about that recovery for people that have been on ventilators. So I do get that question a lot of like, oh, are you feeling okay? Everything good? And like, well, I feel good. I'm happy to be alive, but there's a lot of other stuff that comes with recovery after that.
Yeah,
So
it's
Yeah.
important to hear. It's
yeah,
important to hear. And yeah, it's inspiring, your story of recovery and the willpower that you showed and the strength that you showed. It's inspiring.
thank
We've
you.
also read about different complications from coming off a ventilator and coming out of a coma, like blood clots,
Mhm.
pulmonary complications, heart problems. You
Yeah,
mentioned the terrible weakness. Are
yeah.
those things that you experienced as well? You mentioned seeing the neurologist.
Yeah, besides the neurologist, thankfully I didn't have any other organ failure issues while I was on the ventilator. Um, Nothing with my kidneys or liver or heart, which is really good. I'm glad about that. So no, in terms of blood clots, they were concerned with that, so they were giving me blood thinners while I was in the hospital. And then I have had a follow up. It's called a venous Doppler, where they do an ultrasound of your legs to make sure that you have no deep vein thrombosis or any blood clots in your legs. So those came back clear as well. So that's looking pretty good. My next follow-up will be with my pulmonologist a couple weeks out, and they'll do I think it's called a pulmonary function test, and then a follow-up with him to see how my lungs are working, how much air I'm getting in, and what my function level is there. So hopefully get good news there.
Hmm.
That's great. From experience, can you tell us how people should be prepared at home in case they get sick? Like any medicines they should have, medical equipment?
Yeah, I don't really know, and I'm not, while I'm in healthcare, I'm not patient facing, so I don't have a medical degree. So I would say though, if you're thinking you're getting sick and you're getting symptoms, it's probably good to have some plan of isolation of what you can do to get away from the other people in your family, just to make sure you don't spread it around. And then one thing that was important for me when I was discharged is they gave me not only a thermometer, which we already had a thermometer at home, but they give you a thermometer because they want you to report your temperature 3 times a day for like 2.5 weeks. They also gave me a pulse oximeter, which you put on your finger and it measures the amount of oxygen in your blood. And that's super important because oxygen saturation is something that dropped really low while I was in the hospital. So we were monitoring that. I hear they're hard to find right now, but people who have told me like, oh, I'm having these symptoms, do you think I have it? I'm like, well, I can't diagnose you, but I do tell them, look for these things. And one of the things you should monitor is probably your pulse ox and make sure that,
Definitely, yeah.
if you're dropping below 90, there's a problem there. Like you shouldn't be getting that low. So, yeah, and I don't know the medications. I've heard differing opinions on if you have a fever, treating the fever with, like an ibuprofen or something. I'm not really sure what the proper medical response to that is. So I probably don't feel comfortable giving an opinion on that.
Sure.
But I do say if you're getting symptoms and you think this could possibly be something, it's probably better just to kind of isolate from the rest of the family and let it play out a little bit.
What precautions are you and your family taking now to prevent being reaffected by the virus?
Yeah, so that's the thing. My wife and I both had it. So she
Mm-hmm.
just had mild symptoms. It only lasted a few days, and she did her whole isolation period. And
That's great.
so we assume we have the antibodies. We've
Mm-hmm.
not had an actual antibody test, although I've donated blood plasma already, convalescent plasma for other COVID people who are fighting COVID right now.
Mm-hmm.
I've also done I'm participating in a study through another organization who's going to be testing blood and plasma to find out why some people get sicker than others. So that through that study, they'll be able to confirm the antibodies. That was just this week, so I'll hear about that. But so we don't know that we can get it again, but we're also not sure we can't. So we're continuing to wear masks when we have
Right,
to go
yeah.
out. We're continuing to stay at home. Like I said, I'll be returning to work on Monday, but I'll be working from home. So we're not leaving the house too much unless we really need to get, supplies or something. And when we do go out for like a walk or whatever, we do all the social distancing and everything. So yeah, that's pretty much our plan right now, and continue to wash our hands, that sort of thing. The two little kids
Mm-hmm.
are kind of petri dishes anyways, so I'm always telling them to wash their hands and that sort of thing. But hoping it doesn't come back, and hoping that we don't have um, I'm hoping the antibodies will keep us from having another round of it for
Mm-hmm.
our family. Yeah.
So when you first got out of the hospital, what did you want to do? Like when you first got home?
I just wanted to hug my family. That
Mm-hmm.
was that was it. I was
Hmm.
super emotional for the first couple of weeks. Um, my wife and I began to talk about it, and of course, she saw it from a different perspective. And in many cases, it was probably harder for her than it was me. While I was intubated and in a coma, I was not aware of everything that was going on. Imagine if it was your parent or your loved one, and you're having to wait for a daily update from a nurse or a doctor, and every time that phone rings, you don't know if the news is going to be positive or if it's going to be negative or if it's going to be the worst news that you can expect. So that's the state she was in for about 9 days.
Mm-hmm.
But she also saw things from a different perspective. She's a nurse by training as well, although she's not practicing right now. So she was taking copious notes of the reports she was getting. So when I got home, she was able to fill in the gaps of my memory and tell me what she was being told and what the doctors were telling her. And then I was able to hear from her as well just how bad it was, because I still don't think I realized that at that time that I came so close to dying. So that was hard to hear from her, but it was also helpful to know the full story. And even since then, I've had tons of people reach out that were my caregivers in the hospital, nurses and doctors as well, and they've
Mm-hmm.
given me their perspectives as well. So I've got more of the full story. But all I wanted to do when I got home was just be with my family, hug
Wow,
them.
yeah.
The
Okay.
kids still were fighting with each other when I came home, because that's what they do. They're 4 years apart, and that's what the two boys do, is they like
Mm-hmm.
to fight with each other. So, but even in those small things of fighting, I was
Mm-hmm.
I was happy to be alive to see it
Right, yeah.
and be a part of, and trying to calm them down and stuff. But
It,
yeah, just being with family was the most important thing for me.
it really changes
Yeah.
your whole outlook on life and,
Yeah,
and how you see everything, doesn't it?
it absolutely
Yeah.
does.
And it's amazing to have a support base like that in your wife and with your family. But
Yes.
what are some things that that other uninfected people around the U.S. and students can do to help support people who are infected or to help support medical workers, do you think?
Yeah, I mean, it's obviously a big political debate right now with reopening and whether or not you should have to wear a mask or all that stuff. And for
Hmm.
me, this whole experience has not been political.
Right, of course.
And this whole experience, I see what
Hmm.
the overall impact of the virus on our economic conditions of our country and around the world. And I can see both sides now.
Hmm.
I think people just caring about other people and realizing that right now, my opinion is this for wearing a mask. I probably wouldn't want to wear a mask all the time before I had this, but now that I've had it, I'm willing to do a lot more now if I know that it can help somebody else or prevent someone else from going through what I've gone through. So
Of course.
if it's a little inconvenient to wear a mask when you go out, if it's uncomfortable because it's hot and you can't breathe as well, for me, my personal opinion is I'm willing to do that if it has any potential to help keep someone else from having the same experience. Obviously, people should be washing their hands anyways, and we know that people don't do that enough. I work in healthcare, and it's very hard to even get healthcare workers to be fully compliant with the hand washing standards.
Right.
So imagine it's even in the general public, it's not something that people are doing all the time. So, but things like that, washing their hands, that sort of stuff, keeping distance if you are feeling symptoms, and then also realizing, despite your opinion and where you stand politically and everything else, and that sort of thing, like realizing there's a potential you could be asymptomatic, and if you have it, you could be spreading it to someone if you're close to them, breathing on them, talking to them, that sort of thing. So just a little bit of common sense goes a long way for people. And I don't know, it's an interesting thing that children have not been impacted so much by this. That's something I hope gets studied quite a bit, and we find out why, or if it's just that they don't have the same body response to it, because that is super scary to, if it does somehow mutate or go toward that where kids are severely impacted by it. I was glad it was me for my family. I can't imagine one of my kids going through the same thing and being on a ventilator. As a parent, I can't imagine having to deal with that. So I really hope that we keep that from happening.
Yeah, of course, more than the political thing. I mean, staying safe and staying informed, because staying informed and knowing what's going on, I think that's the best way to be able to make the right decisions and stay safe. And so I know that you've been trying to keep people informed and trying to keep people informed and ready to make the right decisions to stay safe. I mean, it's so essential that the American people hear your story, hear what you have to say, because your perspective and your insight is so valuable. And so, Asha and I, we thank you so much for sharing that and taking the time to speak with us today. And before we wrap up, just one last thing. What do you think is the one message that the American people absolutely need to hear, especially coming from someone like you who's contracted the virus and recovered?
Gosh, I think the one message is, I never thought I would get it, as most Americans probably think, or most people around the world think the same thing. And the reality is, it was me, but it could have been you. It could have been your mom, your dad, could have been your brother, your sister, could have been your coworker, your neighbor, whatever. So for me, I know the virus is real. I know people debate about that as well. My experience proves that it's very real and it's very impactful, and could have meant death for me. So again, I think the one message is just, out of common care and concern for the greater good and those around you, do what you can do to prevent the spread of it in the event that you are asymptomatic. I'm not saying that means that the country has to shut down or stay shut down or whatever else, but we can all take steps in our life in some small ways to help keep other people healthy. And even beyond this virus, that applies to so many other things as well. And, if we just do the things that we can do, I think it'll be helpful for other people.
Of course, definitely. So thank you so much for sharing your
Thank
time
you.
and sharing your valuable insights and perspective. We really appreciate it.
Awesome. Well, thanks for having me on today, you guys. And I'm really proud of both of you for what you're doing, and look forward to what your future has ahead of you as well. Maybe, I don't know what your dreams and hopes are in the future after you graduate and move on to college and everything else. But this was very exciting. I was thankful for your dad reaching out and saying you'd be interested in talking to me. So thanks for making this happen.
Thank you for
Thank
talking
you
to
for
us. Your
joining
story is
us.
really amazing, and we're glad that you and your family are staying safe.
Thanks, you guys. Have a great day.
Thank you.
You
You
too.
too.
Bye-bye.
Bye.